Hello, I'm Matthew Weinstock, Managing Editor for Modern Healthcare. Thanks for tuning in to the latest edition of The Checkup. Hospitals and health systems across the nation continue to adopt new technologies aimed at improving patient engagement. And certainly, as companies like Amazon and Apple and Walmart make further inroads into healthcare, becoming much more consumer friendly is really becoming a critical business imperative for health systems. I'm joined today by Chris Allen. She's Chief Nursing Officer at MSU Healthcare based in East Lansing, Michigan. We're going to talk about some ways that leaders, including clinical leaders, can and should be thinking about adopting new consumer-friendly technologies. So, Chris, thanks so much for being with us today. We appreciate it.
You're welcome. Thank you very much for the opportunity.
So we talk a lot about, in the in our publication and elsewhere, we hear and talk a lot about consumerism and patient engagement and all these technologies that are rolling out that health systems are adopting and adapting for patients. I'm curious to start with, from your side as a nursing leader, how do you think about patient engagement and consumer-friendly technology? What goes through your mind when you hear those words?
Yeah, patient engagement, right, is quite wide. But when you think about patient engagement and technology, we started. So it's been gaining momentum for patient engagement, and it started way back from changing from reactive to proactive care, right? Because we've always been reactive. I'm sick, I go in. Now we've over the years transitioned to proactive care, so wellness. Um, Gaps in care, those types of things. So we really want to focus on that proactive approach. And we've been able to do that with technology and thinking outside the traditional appointment. So, right, it's can I get an appointment with my provider and go in and see that provider? That's great. But the biggest impact to patient engagement is outside the traditional appointment. So we've really been focusing on what does that spectrum look like? So it's behavioral health management, right? Those focuses on might it be a diabetic in regards to eating and nutritional facts, but it's outside that traditional appointment. So we're using technology that reaches out to those patients at those times, or we're using a multidisciplinary team that connects and is a resource to those patients outside to engage those patients in their care at all aspects of their life and during their days.
And certainly this started for health systems before Apple, Amazon, Walmart started
Mhm.
to encroach into the industry, and other companies like VillageMD or ChenMed that have
Mhm.
sort of taken a consumer-centric approach. But I am curious how much of that is starting to drive some of your decision making as well.
Well, it is. And, the other people that we collaborate with is our payers, right? The insurance companies, they've really joined on to say, okay, let's do transition to that wellness and that patient engagement. Let's incentivize, but it's not about the dollar. Me speaking from a nurse, right? It's let's put the patient in the center of what we do and impact them with best outcomes, longevity in life. Those are the reasons we want you to be engaged in your care, connect with your providers or the care team outside the traditional appointments. Those are the things that you really have to focus on, and that's how it sells it, right? I have a personal experience. I have a brother that's a diabetic, very very brittle diabetic that needs a lot of support. And again, getting that technology to be able to have that and connect those dots and engage that patient in those decisions and supporting them on the highs and the lows is very important.
So then, as you think about it from a clinical leader perspective, how do you go about evaluating what technologies you need and when and how to put them in place?
Yeah, absolutely. Well, one of the lessons learned, of course, as all healthcare, hospitals, outpatient settings, urgent cares, everybody was thrown into the pandemic, right? So now we look back and we say, okay, so we brought up telemedicine. Even though we had telemedicine visits for some of our remote areas, we were able to bring that up within a couple of weeks to all of our services. So we that's where you have to focus. If we could do that then what are those other avenues of doing that? Again, another lesson learned from the pandemic, people don't want to wait in waiting rooms, right? They want to decrease their exposure to others. So we've implemented some products. Epion has been a great product that we've added on to our EMR that allows remote patient check-in. Think about that. If I can check in from my home, either I wait in line for an urgent care or an ER visit, or I wait in line for my primary care or my specialist, and then I come in directly to my room. Those are key aspects that we're continuing on moving forward, or remote patient monitoring. Closing the gaps in care for patients. If I am a heart failure patient and I need to do my weight checks on a daily basis, and we're having patients do their checking their weight at home, can we get that into our system where they don't need to come in for a traditional appointment? Those are the types of technologies that we're really starting to tap in, and healthcare really has to focus on that because the hospitals aren't the where to go. MSU Healthcare is not aligned or does not have our own hospital. So we're really strategically looking at all of our partnerships with the healthcare entities around us on how we can impact that outpatient care and go to the patient homes or out into those rural areas where we can provide that access to care.
Yeah, and I want to jump into the rural in a minute, but it
Mhm.
is interesting as we think about the evolution. As you were talking, I started to think about, we started many years ago with check the ED wait time on your computer or on a billboard on the highway or something, to just a handful of years later. Now you're talking about a remote check-in where you can check in online and then actually show up to your appointment at that specified time. Seems like we've made pretty significant leaps in a very short period of time.
We have definitely. You think about, we hear a lot from our patients say, "How come you keep asking me those questions?" or "Why do I have to fill this out on paper?" Those types of things. Now it's a seamless process of, yes, I'm checking my medications when I come in, right? It's electronic. I'm checking that myself, so I'm seeing what's in the system for my own eyes instead of completing paper or having to repeat that information over and over. That's been very helpful.
Yeah. Um, Sticking with that last question, though, of sort of evaluating a technology, how then do you decide, or how do you look at the benchmarks? What benchmarks do you set to say, boy, this is really working for us, or we're going to have to pivot in a different direction?
Yeah, we've started to look at patient populations. So, some of the most vulnerable patient populations, maybe by diagnosis, maybe by location, maybe lack of access to care, those are the ones that we're looking at, right? Psychiatry, mental behavioral health, those are focuses all across the nation that have been a focus. We have a Department of Psychiatry that we've been working with, that we provide services up to the UP. So, those are ones, right, currently that we look at. The other ones are neurology service lines. So we're really looking at service lines where there is a great need within the patient population that we look at. And then we look at what does that need look like? Is it remote access? Is it adding to our multidisciplinary team, adding a social worker that can help us with that management? So we're really looking at it from a multitude of aspects in regards to technology, multidisciplinary team, but also looking at it based on service areas and greatest need there.
Right, right. So let's talk a little bit about your rural population that you deal with. You mentioned the UP. I think any of us who have gone camping up in the UP know that broadband is and cell phone access is not ubiquitous up there. So what
Mhm.
kind of unique challenges does that present to you to roll out consumer-friendly digital technologies into some of these rural areas?
Yes, that's setting up, again, going away from bricks and mortar, but doing some satellite locations. That has been you touched on at the beginning, right? That's why Myers, Rite Aid, Walgreens, those areas. We have partnered with a company called Higgy, that has remote monitoring stations that are located in locations such as Myers, Rite Aids, those areas. And those connect back to our EMR, give access. So it's a central location where they have to go for groceries, those types of things. And so we've been partnering with those and looking at those opportunities. So that is one that we're looking at, or that we're actively involved in.
And how do you find them? Do they come to you, or are you going to them, or is it sort of a mixture?
It's a mixture, both. There's a couple of different options. Again, depending on doing an assessment of their remote area. If they don't have internet or cell phone reception in their home, then we do go to a central location that would cover a wider spectrum that they could go to. If transportation is not a challenge, so we look at that as well.
Are there areas where, if a health system is starting down the road of moving beyond sort of the digital check-in, but starting to think about more advanced patient engagement, consumer-friendly technology, are there areas where you started that you found it was really successful? And conversely, are there areas that you may have done some stuff that you thought, boy, we jumped in too quickly there?
I think one that we've started on that, again, that, the telehealth platform was one. I hate to keep going back to that one, but right, it was used in a small portion, brought it up quickly. We have done a study adjust of what
Mm,
we did bring up. We've had to improve that because we were finding that there were some populations that didn't have the availability to do the visual, like Zoom or those types of things. So then we went to with the emergency orders, we were able to do just phone discussions. So there is some management with that we have used. It's been a small component of that is now dwindling away as we're being able to implement the remote check-in and those types of things. But that was one that we've really kind of fostered and went through over the last 16 months through, the changes of the pandemic. So.
right. And from the clinical side, what has it been like for your nurses and doctors? Has there been resistance to adopting some digital technologies?
There has been. There's been some resistance. There's always that initial fear that we're going to lose a population, right? Or we're going to leave a population out.
Mm,
And of course, we always go to the older population, right? The geriatric population. But I'm the first to say my mom's more techie than I am, so we can't leave them off. But then we also have the newer generation that also want to do more with technology, but really you still need to see providers. So it's both spectrums of those, but you want to make sure that you're looking at across all the generations and adapting to that. So you can't paint everybody with the same paintbrush. You really got to be able to accommodate to all of them. And I mean, we have 30 plus clinics with a wide spectrum of everything from young, pediatric population to the geriatric population. We have contracts within nursing homes. So we look at the access there as well to where they couldn't go out during the pandemic. Again, so we had to bring some services to them. Not that it was bringing more people in there because that increased
mm.
the exposure, but then we needed to make sure that they had the access and the people that could support them to get on. So those types of things.
Right, makes sense. And lastly, Chris, one of the things that we've talked about with other folks on the digital health side is we're potentially creating a new social determinant of health, and a new disparity where access isn't accessible to everybody on the digital front. So, how do you think about that? And how do you approach it at MSU Healthcare?
Yeah, we've really started to increase our relationship with our local health departments. We did this through COVID, and we went out actually into communities that did not have transportation. They were well within our county. Currently, here are our surrounding 3 counties. We work within the Tri-County area, but we've really increased and leveraged our partnerships where we've taken remote clinics to those areas, like a stand-up type of a remote. And we are going to continue that effort. That's one that we're still starting to look at. And we have some of those concepts here at the university, right, within our neighborhoods of the students. So we've just kind of really increased that type of a neighborhood, type of a remote clinic that goes on site where there's a need. If there was an outbreak, that's what we did for COVID testing. And we're doing the same things currently right now with vaccinations, again, getting it out to those areas. So now we're starting to pivot that to our population that we serve in our gaps in care. So if we have a gap in care with heart failure patients that aren't able to get to their appointments, or we have a clinic that has a high no-show rate, we're starting to look at the demographics of those populations, and then can we go to them? And is that a population that would really foster into some remote patient monitoring, more electronic technology, and those types of things?
Interesting. So some real lessons learned from COVID that you're going to be able to apply in out years and out conditions that aren't COVID related at all.
Yes, and I think the positivity of that, again, goes back to what I said. We're going to the patient. Instead of
Hmm.
the patient waiting for us, we're going to the patient, and we're fostering that relationship. And when you're looking at it based on diagnosis specific, you're really getting to those individuals who need us the most.
Got it. Got it. Well, Chris, we appreciate your time talking about the rollout of digital technology. We'd love to stay in touch and see how some of this stuff works out post pandemic, as you roll it out to other populations and other conditions.
Yes, absolutely. Thank you very much for the opportunity. We greatly appreciate it.
Thank you. Stay safe.
Thank you. Thank you. You as well.
And I'm Matthew Weinstock with Modern Healthcare. Be sure to come back next Monday for another edition of The Checkup.